Dr. Priyanka Batra. I am Senior Consultant in the Department of Gynae and Gynae Oncology in Medanta Gurugram. So today we will be discussing about the ovarian cyst. What are the ovarian cysts and how do we manage it? Let's understand what are ovaries. Ovaries are basically our reproductive structures. There are two pearly white structures on the side of the uterus, and these ovaries secretes the hormones because of which we get our periods every month. So there are sometimes some abnormalities in the form of cyst in the ovaries, which is a very common condition for which a lot of patients come on daily basis. Ovarian cyst, basically cyst is a fluid filled structures. It's like a small balloon, and this ovaries may get some balloon like structures, which is called ovarian cyst. So ovarian cyst, how does it form? Ovarian cyst, how does it form depends upon its nature. Cyst may be totally asymptomatic, patient may not have any symptoms, and patient may present with some pain if this cyst get twisted on its axis. So depending upon the type of the cyst, let's understand how many types of the cyst are there. The most common variety is physiological cyst. Physiological cyst or follicular cyst are the cyst when in every cycle in the ovary an egg is formed, and when this egg gets released, then the remaining part becomes the cyst, which is corpus luteum cyst. Sometimes this corpus luteal cyst or hemorrhagic cyst may increase in size, and patient may present with an hemorrhagic cyst with little bit of pain also. These cysts get resolved by itself, and we do not need any active treatment for this. Some painkillers may be prescribed, and there is, in the cases of follicular cyst, physiological cyst or hemorrhagic cyst, there is no need to worry. Give 2 or 3 months periods, and after periods repeat the ultrasound after 2 to 3 months, and most of the time these cysts get resolved by itself. And now if we see at the other type of the cyst, there are other cysts like the dermoid cyst, endometriotic cyst. These cysts may require treatment. So how to diagnose an ovarian cyst, how to see which type of cyst is this. So whenever a patient comes with an ovarian cyst, the main thing is to diagnose whether it is cancerous or it is non-cancerous or it's benign or physiological. First line investigation is the ultrasound. If the patient is married, then the transvaginal ultrasound, which is done through vagina, is the best modality. This ultrasound will tell us about the size of the cyst, the nature of the cyst, whether there are any solid areas or no, whether this is a physiological or no. And then we do corroborate it with certain blood investigations, certain tumor markers, depending upon the nature of the cyst and the type of the cyst and age of the patient. And then on the basis of history of the patient, how rapidly the cyst has grown, how big is the size, we correlate it with the investigations, our ultrasound, first line investigations and blood test. And then if we find that this cyst is some suspicious or something, then we go for the MRI testing of the body, the MRI of the pelvis and lower abdomen, which most of the times differentiates between a cancerous and non-cancerous cyst. If a patient is postmenopausal, if cyst is solid, then we should be more cautious and we should go for MRI. And on the basis of all these tests, along with the history, we can make a proper diagnosis of the patient, and the treatment of the cyst depends upon the diagnosis of the cyst. If the cyst is physiological, then we go for observations, and if the cyst is benign, then we treat medical management, and if the cyst is very big in size or it is abnormal or suspicious, then surgery may be required in such cases. So we investigate thoroughly to a patient and then we make a decision regarding the surgery.